So Found Care offers medical care, but what about those without insurance? Is there some place to turn? Well, it turns out that the Palm Beach County Healthcare District does have some programs that you may qualify for, and it's all paid for with your tax dollars, so it's worth checking out. Here's one gentleman that found that it was his lifeline. Robert Wallens has spent most of his life in a much more fast-paced way, working in New York City in the telecom industry. But after his wife passed away, he needed a change.
I was prepared, actually, to live and work in New York City and teach in that school because I felt very positive that I was actually making an impact. But I felt that for my own sake, that I needed to come home here to Florida. I was a Florida resident the entire time.
Soon after he moved here, he found himself feeling ill, short of breath. And after a $2,000 visit to a local emergency room, he got the diagnosis.
I was no longer covered by a policy, and I noticed that my breathing was getting progressively worse. It turns out that I'm allergic to anything that's green here in Florida. It's not that I have a problem, it's just that the problem is there are so many things, so many lush things growing, and my poor body is only used to Midtown Manhattan grime and smog.
Wallens was in trouble with his health and his health care.
I said to the cashier, I have no money. And that's exactly what I said. I figured, let me start from that perspective. And she said, what's your income? And I said, what income? And she looked at me, and it turned out that there was this thing called Vita Health.
Vita Health are premiums that need to be paid on a monthly basis, and then we pay the 2/3 shared cost of the premium for the member.
Customer service, Esther speaking. How may I help you?
The low-cost insurance program is funded through the Palm Beach County Healthcare District and covers primary doctors, outpatient, and hospital visits. That fact helped Robert breathe a little easier.
I was actually afraid to go for regular checkups and so forth. It was discovered that I had some issues that are more age-related than anything else, and I was given some medication to deal with it.
Ronnie is the Director of Eligibility for all coordinated care plans. She says the uninsured crisis is not just affecting the poorest communities in Palm Beach County.
It's hitting a different population now. Many of our clients never had to apply for any programs before in their life, and they're unemployed, they're losing their home, they're going through foreclosure, and they have sickness and they need coverage. They have no other, choice.
At the Coordinated Care Call Center, residents can be directed to the plan that is right for them, from options that offer free care to the Vita Health program, which is available to nearly everyone.
That's the only drawback. If you're eligible for Medicaid, Medicare, veterans benefits, Florida Healthy Kids, then you will not qualify for our program.
Robert says what he pays each month is minimal compared to what he has gotten back.
I didn't even know that I had life-threatening situations going on with me. And they helped me with that immediately. And I'm basically very, very grateful.
The numbers applying to the district's health coverage programs have increased 30% this year, and Ronnie doesn't see that going down anytime soon.
Well, the numbers are alarming. For instance, if you look at the Glades, they have increased almost 50%. The economic downturn is really affecting in the western suburbs, but you see it in Glades, and you see it in Boca, in Delray, West Palm. It's all over across the board. It's affecting everyone. Now it's affecting the middle class, which we hadn't seen before.
But many wait until it is nearly too late for help.
A lot of people, for instance, come to us that are really sick. They wait until the last minute. They're not the most prepared, and that's why we've got to move quickly. In order, sometimes it's a matter of life and death.
I'm not alone at all. When you read the newspaper and you see how many companies are letting go personnel or watering down existing medical coverage, you realize that there's this gigantic healthcare problem that's looming, and it's coming to a house near you, if not your own home.
Vita Health is just one of many programs run by the Palm Beach County Healthcare District. Joining me now is the Administrator of Public Affairs, Robin Kish. Welcome.
Thank you.
So Vita Health, we saw how much it was a help to Robert, but there are other programs if you don't quite fit the requirements of that one that are currently available.
The Healthcare District of Palm Beach County offers a number of different health coverage programs, and there are currently more than 40,000 unique health coverage members that the Healthcare District serves through all of its programs, coordinated care, personal health plan, and Vita Health as well, and maternity care program also.
And how do you find these people? Like in our story earlier in Found Care Health Clinic, we saw that they're just being inundated with the newly unemployed, wondering, how do I get care? Do they kind of somewhere happen onto you, or are they referred? How does that occur?
They are referred, and we are also receiving so many requests for applications. Members are enrolling for all of the programs. We have seen over a one-year period a 30% increase in membership across all of our programs, and we don't expect that that demand is going to decrease anytime soon.
And looking at Washington and the reform there, you and I were talking before we went on the air, it's going to affect the healthcare district, dramatically, because you already have these programs, so who knows what's going to happen, right?
The healthcare district has been a constant in the community for 20 years. We're celebrating our 20th anniversary this year, and I think everyone who serves the communities throughout the country in terms of providing health care is looking at the federal government to see how these plans end up shaping up and how that will impact the local communities. For those communities who don't have an infrastructure like we are fortunate to have here in Palm Beach County, there may be some programs that, if they overlap, the federal programs would supersede the local programs. But for those communities that aren't fortunate enough to have these programs already in place, some of those residents and community leaders are looking to the federal government to then offer the options that we currently enjoy here. And
does your board or do you have any kind of hopes that this is what will come down to Washington, to Palm Beach County? Do you look for specific things in the plan?
Well, because the healthcare district serves a number of different needs in the community. I mean, it's definitely a healthcare system that improves the quality of access in the delivery system of healthcare. We look at how the federal reform might impact hospitals, since we operate the only public hospital in Palm Beach County, Lakeside Medical Center. We look to see how it would impact health coverage programs, because we offer, as you know, a number of different health coverage programs. So our different programs obviously may be impacted in different ways.
And we met Robert, but the requirements for all the different programs, are they specific to those programs so that you can fit? We know there's a lot of newly uninsured in our community. Is there kind of niches, should I say, for different needs right now within the different programs you offer?
There is, and that is why Vita Health, which was the most recently launched program, was developed to serve the needs of those residents who were working and were either not offered insurance, or because the insurance that was being offered was too expensive. That program not only was launched in 2006, it was then expanded so that more people would be eligible. And there are certain eligibility requirements. You must be between the ages of 1 and 64. You must be a Palm Beach County resident, be without health coverage for 6 months, and also not be eligible for state and federal programs like Medicaid and Medicare. And the income levels, you must be earning within 300% of poverty levels, which is less than $32,490 for an individual and $66,150 for a family of 4. So really, you're looking at a lot of people in our community right now.
Absolutely.
And so we are seeing Vita Health grow, as well as all of our other programs.